Hello everyone, my name is Nicole Ramirez and today I will explain and demonstrate the proper use of the UNC 12 probing instrument. This probe has a handle, a shank, and a thin working end. It's used to record depths up to 12 millimeters and has markings at each millimeter. In black colored bands, it's at 4 and 5 millimeters and 9 and 10. This instrument is used to measure periodontal pockets, but also it can be used to measure clinical attachment laws, measure lesions, assess bleeding, and measure recession. To hold this instrument, you must use a modified pen grasp, which is your index finger and your thumb, creating a soft C shape, just like this. The middle finger resting on the shank. The ring finger is going to be your fulcrum, resting on any tooth, and the little finger has no function at all, so it just stays tucked in, just like this. The cowl, which is a clinical attachment loss, is the distance between the CEJ and the junctional epithelium. The depth of the periodontal pocket is determined by measuring the distance of the gingival margin to the base of the sulcus. We need to record measurements up to each tooth has 6 sections, okay? So it's 6 measurements per tooth. The distal facial, which is right here. This is a distal facial. Then it's a facial. The mesial, which is right here. So it's the distal, the facial, and the mesial. So that's 3 measurements. And then you go on the inside, which is the distal lingual, which is right here. Then it's the lingual, and then the mesial lingual, which is right here. When you record a number on each section, you record the deepest measurement. Okay, so say you start right here on the distal line angle, and then you walk the instrument back and you record the deepest depth. And then you start again at the distal line angle, you walk the instrument all along the facial, you stop here at the mesial line angle, and you record the deepest depth. And then you start again here, you walk the instrument, and you stop right here at the cold space in the interproximal area and then record the deepest depth right there. So that's 3. When you start to take measurements of the whole mouth, we always start at number 1. So it's the upper right. You start at number 1, facial, all the way to number 16, all the way on the upper left. And then you go from the palatal from 16 all the way palatal, all the way up to 1 again on the palatal. And then you drop down to 32 on the buccal. And you measure all the way around to 17. And from 17, you go on the lingual, and then all the way to 32 lingual. So you're stopping at 32 lingual. That's where you end your measurements. So we start at the distal line angle, and we go to the bottom of the sulcus. So right here, we start right here. This is our first measurement. We go to the bottom of the sulcus. We push lightly until we see blanching of this GE. Once the probe is inserted into the periodontal pocket, just like that, the working end is parallel to the root surface. The tip is flat against the root surface. We walk the probe distally into the interproximal area until we meet the contact. So we start right here, so make sure it's parallel. We walk the probe, make sure we have the C shape and the fulcrum. We walk the probe all the way into the interproximal area, the cold space. And once we get into the cold space, we tilt the instrument, the working end, 10 to 15 degrees into the cold space. Just like that. We end here. That's our first number, our first measurement of the tooth. Okay? And that's once you're done there, you take it out, the instrument, and that's the only time you can take out the instrument from the gingiva. And then we record our deepest measurement, then we remove the instrument, and then we start at the distal line angle and make sure the working end is parallel to the tooth. And then we're going to walk the instrument to the mesial line angle, record that number, and that number is going to be the facial, so that's our second number. And then we start again at the mesial line angle, and then we walk the probe again, until the cold space, and then we tilt again, just like that. We tilt and get our third number into the cold space. That would be our third number. And then we're going to do on the lingual surface, just like this. We're going to insert our instrument so it's parallel to the root of the tooth. So this is going to be the distal line angle. And then we're going to walk the probe into the interproximal area. And again, tilt the instrument so it's 10 degrees, and we record. That's when we take out the probe, and we start again at the distal line angle. We walk. Okay, we get our 5th reading. We measure. We record our deepest measurement, and then again, we don't take out the probe, and then we walk it into the interproximal area. We tilt the instrument 10 to 15 degrees into the cold space, and we record our 6th measurement. Okay. Now we're going to start in the correct area. We're going to go from 1. So we're going to record We're going to insert our probe into the distal line angle. We're going to walk to the interproximal area. We're going to tilt 10 degrees and record. We're going to remove the instrument and we're going to put it in the distal line angle. We're going to walk to the medial line angle. We record deepest reading, and then again we're going to walk into the interproximal area medially, tilt the instrument 10 degrees and record. We remove the instrument. We're going to go to tooth number 2. We're going to insert distal line angle, walk into the cold space, interproximal area. We're going to tilt 10 degrees and record. Remove instrument, put it in the distal line angle, walk to the medial line angle, record, and then keep walking into the interproximal area, tilt the instrument 10 degrees and record. We're going to do this all around. So we're going to get to tooth number 8. Okay, so we're going to put the instrument, the distal line angle. We're going to tilt the instrument towards the root. We're going to walk to the distally into the interproximal area. We're going to tilt the instrument 10 degrees and record. Remove instrument. Again, put it in distal line angle. Walk, medial line angle, record. Walk, interproximal area, medially, tilt the instrument 10 degrees and record. We're going to do this all around to tooth number 16. Now we're going to go on the inside and say we're on tooth number 8 again. So we're going to put the instrument, medial line angle, okay? We're going to walk, medially, tilt the instrument 10 degrees into the interproximal area and record. Take out instrument, medial line angle, walk, distal line angle, record. Distal line angle, walk, interproximal area, tilt instrument 10 degrees and record. So note that the measurements we give are an accurate assessment of your gum health. In health, the measurement is usually 1 to 3 millimeters and sometimes bleeding. There should not be any bleeding or pain if your gum is in health. If the measurements are 4 millimeters and above, those are symptoms of gum disease. Note, we also don't probe when a tooth is in distress. If it's cracked or the patient had dental surgery or bone grafting, that's when we don't probe. But other than that, we probe every single time the correct way. Thank you. That is the proper use of the UNC 12 probing instrument.